insurance administrator, Medi Assist 1,170 crore issue will open for subscription on the 15th of January and close on the 17th of January. This will be India's first health insurance TPA to be listed on the Lal Street. Now, what exactly is a TPA? TPA stands for a third-party administrator. It basically acts as a link between the insurance company, healthcare providers, i.e. hospitals, and the insured party, i.e. a patient. Now, when you go to a hospital and you've been hospitalized and you have an insurance claim, more often than not, you will first go to a TPA. You do not directly approach the insurance company. You go to a TPA who will assess all your documents and finally settle the claim. All that settlement claim process is done by the TPA, and therefore it acts as a link between the three parties, the insurance company, the hospital, and the patients. Medi Assist is one of India's largest TPAs. To talk more about it, we're joined by the chairman, Mr. Vikramjit Chatwal, and the CEO of the company, Satish Girugu, on the show. Gentlemen, thank you very much for joining in. First, Vikram, tell us a little bit about Medi Assist, the history behind this company.
The industry, thank you first of all for having us over at the venue here with you. I guess the industry is not that old. We're about, it all started back in 2002, so it's a very young industry and coincides very much with private insurance and India. Medi Assist has been amongst the earliest third-party administrators. We started our journey back in 2002. And for a host of reasons, coming out of southern India, Bangalore, we ended up working with large insurers and with large employers. That's been the mainsail of a lot of the work that you see, a lot of the performance in the business that you see today. Over the years, Medi Assist has transformed itself to not only act as a key third-party administrator partner to the insurer, but also to the policyholder. And at the same point in time, I think we've also evolved alongside our partners to build a backbone of technology and a backbone of strong networks of hospitals, doctors, clinics, primary care physicians, so on and so forth.
This company was founded by an ex-Infosys founder.
That's right.
Tell us that journey. How did Bessemer come into the picture as a promoter?
So the company, interestingly, was set up by one of the co-founders of Infosys, Mr. Raghavan. Mr. Raghavan set up the business back in 2002. The business was then in partnership with Reliance, the Anil Ambani Group, in 2006. And Bessemer and I came in as part of a management buyout in 2010-11.
Okay, got that. Now, this is your second attempt to raise money from the Lal Street. You all had filed your papers with SEBI in 2021. Why didn't that proceed?
Back in 2021, for a series of strategic considerations at that point in time, and of course we were entering smack in the middle of the pandemic, the first wave of the pandemic, were some of the reasons why the issue was parked at that point, and we've come back to the market now.
Tenuous market conditions, I understand, the external conditions, but what were the strategic considerations from the company's end?
As you will see in our business over the years, M&A has been a key theme. Yes. So you will today experience a bunch of acquisitions that we've done and are in various stages of integration. And specifically beyond that were specific issues that were pandemic related and today are behind us. Okay. And so here we are back again with you.
7 acquisitions in the last 8 years, I believe.
That's
so M&A and the COVID was the reason why the 2021 IPO didn't proceed. Okay, now tell us, how does this company make money?
As a TPA, for all TPAs in the Indian market, we make money as a yield. From the
insurance company?
From the insurance company and only from the insurance company, purely. And it is a fee that we charge, which is built into the premiums that the insurer charges the end policyholder.
Okay, so suppose your gross premiums, for the sake of simplicity, is 100 rupees. What is the average fee that you earn from it?
It's hard to pinpoint a specific number of average fee, but I think a good ballpark number would be between 3.5% and 5.5%
Okay. So
of the premiums.
Of the gross premium that you are
collected.
managing, you will earn 3.5 to 5.5%. And how is this yield changing? Has it been coming down over the last few years due to competition, pricing? Because there are 16 TPAs, so I'm presuming this market is fairly competitive.
It is competitive, although the yields are well balanced amongst all of us, and we don't necessarily have differentiation between two TPAs. But directionally, I think the view is that the yields have been stable, and that's been for a long time now that the yields have typically been stable.
Fair enough. Satish, you'll also divide the business into the revenue that you make from group, basically corporates like Network 18 or a Reliance. You also have retail insurance from individual employees, and then you have government. Break up your business into these three buckets, and which amongst these is the fastest growing?
So we've always been fairly strong on the group segment, and given our core DNA of where we started, and historically group has also led the health insurance growth, and group has grown faster than retail, barring that 1 or 2 years in the COVID period. So I think we've been able to ride the wave of the growth in the group, and we are significant market share within the group business. About 74% of our revenues come from the group business today. And about between retail is an area of focus for us, clearly, because retail is also important. And retail would amount to about close to 12% of our revenues. So we work with 27 insurers on the group side, and we work with 13 insurers on the retail side. So that's sort of the mix.
So predominantly 74-75% of your revenues comes in from group insurance, which is basically corporate clients.
Yes.
And I believe you work with 38 out of the Nifty 50 companies, and more than, I think, 30% of the BSE 500 companies by way of corporate clients. Yeah. Okay. So how big is the group insurance market, and what is the growth rate?
So group
and the penetration?
So the health insurance market historically has grown at about 19-20% compounded growth rates. Group has been growing at almost 24-25% CAGR, especially since COVID, as employers added a host of new benefits and expanded the benefits that they offered to the employees. Right.
Fair enough. You also want to increase your share of retail. That's what you say in the RHP. So right now you're at 12%. What would that number go up to? And is there a difference in the yields between group and retail?
There are marginal differences, because typically I think the best way to look at yields is by product, because each product has a different complexity and then different kind of workloads for the administrators like us. And there's a host of innovations that are coming in the product space today, right? And each product carries its own yield. Clearly retail gives us the ability to participate in about 32% of the market, right, which is what it is today, while group has 58% of the health insurance market. Okay. So clearly I think that's an area of interest and growth area for us.
Fair enough. Talk about the government business. Mm-hmm. That's also, I think, about 10-15% of your overall business. Here you cater to government schemes like Ayushman Bharat.
Correct.
But there, it's not that the government employee will be paying premiums to you. So how does that business work? And is there a risk of receivables?
Well, first of all, I think this is not for government employees, but for every Indian citizen.
Insured, yeah.
Second, I think in any economy and in India, the government is a key participant in the healthcare ecosystem. Clearly in India, Ayushman Bharat and the various schemes, both at the center and at the state, have created an environment where the government will be the largest and an integral part of provisioning of healthcare using insurance as a mechanism for payment. Now, I think the Indian market is interesting because we are not only today the largest health plan in the world, but more importantly, I think our participation with government is something that we have taken as a company that's core to the philosophy of working not only with those who pay and can afford to pay, but those in the indigent populations who cannot. Receivables is becoming a lesser challenge today.
It was a challenge before?
It was a challenge in the past, but today I think as the mechanisms of settlement, the mechanisms of payment have become far more slick. And in many ways, the insurers are still our core partners, even when we work with government. So really, receivables is not a challenge anymore.
Have you written off any receivables?
Not necessarily, very marginally over the years.
Okay, but do you have long-dated outstanding receivables?
They could
the
be,
credit cycle
in some cases, they could be a little longer, but never. The promissory note to pay is always fulfilled in that sense.
Fair enough. Let's talk about the issue per se, right? The price band has been set at 397 to 418. You're looking to sell 2.8 crore shares between the promoter entities and the other shareholders, which makes your size 1,100 plus crore. Now, this is a pure offer for sale. Why didn't the company look to raise fresh money?
I think, you know, it's a fair question that we've been asked over and over again. The company has remained profitable and cash generating over the years that we've been in business. We have funded all of our acquisitions from internal accruals and our own cash. And today have enough cash sitting in our books that does not necessitate us to go out there and raise further capital.
So what's the cash on your books now?
If I remember right,
145 crores as of September.
Sorry, could you repeat?
About 145 crores, you know, cash balance as of September 30th. This is after paying for the acquisitions from the internal accruals.
And you've never required external funding for any of these acquisitions?
Never.
So every year, what's the free cash flow generation, approximately?
So we convert almost 90-95% of our EBITDAs into operating cash flow. So I think that, so we've always enjoyed the negative working capital cycle. And all of our acquisitions were funded with internal accruals till date, and we remain debt-free as a company.
Okay. So now back to this offer for sale, right? You know, promoter end, I think promoter shareholding is about 77-78%. After the stake sale, and there are three promoter entities who will be selling. You, Bessemer, and also Medi Matter.
yes.
What will the promoter stake stand at post this IPO?
Post that, between Bessemer and I, which are the two promoter entities that continue, we'd have circa about 40% still in the business.
And do you have plans to further bring it down? Why did you settle at this number of, you know, 1,100, 1,200 crore?
There is no plan to bring it down any further at this point in time. And so we'll see how things pan out over the next coming years. At this point in time, both Bessemer and I continue and intend to stay continually invested in the company.
Stay invested, fair enough. Now about the financials. Now FY23 revenue growth was about 25-30%. Historically, what's been the top line growth rate for the company, say in the last 5 years?
So I think last 3 years is a better representation of the mix of the business, very focused on group and retail, with very limited focus on government, not necessarily being a top line driver, and after having divested many other businesses. So I think we've always bettered, in the last 3 years at least, both the group and the retail growth rates in the market. So I think we've grown faster than...
numbers. What's the industry growth rate and what is your growth rate then?
So we've grown in group, we've grown at about 37-38%, you know, compounded growth rates against the 25-26%, you know, in the industry. Retail against the industry of 16%, you know, we've grown at about 26%. So I think that's been our, you know, core focus area.
Okay. A question that I have is that if you are an intermediate, right, an intermediary, how are your margins so high? Typically, a middleman doesn't earn, you know, very high margins, and yet your margins have been stable at about 23-24%. Can you explain this margin performance of yours, and is it sustainable?
On a lighter note, it shows that we are not just middlemen, and we are important. We are important to the whole industry. We are directly and independently regulated by the IRDA. So clearly, I think what we deliver is a very core, you know, part of the service delivery in helping health insurance.
But your yields are 3.5 to 4, you know, 5.5%. So then, how do you arrive at that EBITDA margin of, you know, 23%? And also, your gross premiums are going up at a very rapid pace. But yet, that operating leverage to improve margins hasn't happened. Your margins have been steady. So just explain the margin dynamics.
So clearly, I think the reason why our margins are, you know, better than our peers and the rest of the industry is our focus on technology, our very high, you know, retention rates of customers. Like in group, for example, these are annual contracts, right? So every year, every corporate has the opportunity to change the TPA. Yet we have a 94+% retention on an annual retention business, right? So high retention rates, significant leverage of technology, our ability to move our members away from reimbursements, which is a very painful process both for the members and us, to a very high cashless, are one of the key reasons why our margins are better.
You said your margins are higher than the industry.
Yeah.
What are the average industry margins?
So typically in low double digits or
Low
high
double.
single digits.
Okay. And do you think your margins are sustainable?
So I think one of the important things that that has changed, especially in the last 3 years, is the claims volumes have significantly, grown since COVID, especially as the outpatient and various other flexible benefits came in. In fact, last year, Rima, we processed more outpatient claims than inpatient claims for the first time in our history, right? So I think when you look at stable margins, that has absorbed all of that claims growth, which is very disproportionate to the revenue growth.
Fair enough. Now, about that acquisition, right? You've been an acquisitive company. In the last 1 year, you've made 2 acquisitions, Raksha and Medvantage. And if I look at the margins of both these companies, they're lower. For Raksha, the EBITDA margins were 6.4%, while for Medvantage, it shows minus 54%, versus Medi Assist, standalone margins of 23% plus. How are you planning to integrate it, and are you worried that this will drag your overall margins?
Not necessarily. I think we have a reasonable operating template.
Okay.
And I think we have a great mechanism to bring everybody back into our technology platform fairly quickly. And it is just a matter of a few quarters for them to flip into our operating template and add synergies today.
So you're confident that consolidated margins will not drop below the current level, even with the acquisitions of current
For a short span, maybe, but otherwise it'll be back on track fairly quickly.
Your consolidated revenues should now be 600 crores now, roughly, on an annual basis with these acquisitions?
I think for September we've reported 300 crores.
Okay. And we should assume a growth rate of about 20-25% to continue, 25%?
Historically, that's what we've grown.
And there's no reason to believe the historical growth rate of 25% will not continue?
We continue to be believers.
For as long as the market continues to grow, as long as our health insurance partners continue to grow, I think we pretty much tag and mimic how our partners grow.
Okay. Since we're on the subject of acquisitions, you have again said in the RHP that you will continue to scout for acquisitions. Are you looking at acquisitions right now? Is there anything on the table?
At this point in time, nothing.
Okay.
But we remain opportunistic and will continue to keep an eye out.
Back to competition, right? Is there undercutting? Because you are the market leader. There are many smaller TPAs, 16 TPAs in the healthcare space. If they're looking to get market share from you, is there undercutting? Is there a bit of a price war that takes place?
I think in our experience as Medi Assist, we haven't really seen that. And it all boils down to the strength of our relationship with our insurer partners, the strength of our relationship with our enterprise or group customers, and most importantly, the service experience that we've delivered.
Now, one way to bucket your group, to bucket your revenues is group, retail, and government. And we spoke about it. Another way is via the insurance companies. Now, 75% of your insurance companies are the government, the PSU insurers, while the private sector or the private health insurance companies are about 25%, though that number has been growing. Now, PSU insurers largely are losing market share. Is that a bit of a worry for you, that you have aligned yourself to PSUs where they're losing market share?
Not at all. I think the PSUs have been the foundation stone of penetration of health insurance in India. They still command a large share of all premiums acquired or sold every year. I think, again, we work both with PSU and private insurers equally. And as business resets itself between the both of them, we continue to have an equally responsible partnership with both PSU and private insurers.
So your contribution of private insurers is going up. From about 15% in FY21, it came to 21% in FY22, to nearly 25% in FY23. When you talk about business reset, what's the optimum mix, maybe in 3 years down the line, as you see it?
I won't be able to give you a sense. I think both PSU and private insurers are core partners in our journey of growth, in our journey of service, and in our journey of delivering quality experience to the policyholder. It's something that will evolve over a period of time, and we're pretty much equally present in both relationships.
One of the acquisitions that you did was Mayfair UK, which gave you exposure to the global markets. The revenue contribution of international revenues is about 5.5% as of last year versus practically zilch 2 years back. What's the international expansion plan? When you look at acquisitions, are you looking to grow the international markets more? What was the thought process of going global?
So, thank you for asking us that question. For both Satish and I, and for Medi Assist, I think the view has consistently been that we are a very India-focused, India-only, India-centric play. Our global expansion and partnership with Mayfair WeCare is largely as looking at India, and as India Inc. globalizes, how do Indians that have overseas, Indian employers that have overseas deployments of people, Indian travelers, business or leisure, and how do we actually create a seamless experience between what you get here with us in India and what you get in the rest of the world. Okay. Today with Mayfair's worked for the last 20 years with Indian enterprise customers in managing their global footprint of employees. And today we have that expansion in 138 countries, where if an Indian were to travel for work to one of these destinations, it's a seamless switch between what happens in India and what happens in the rest of the world.
Satish, I want to talk about your market share very quickly. We have the numbers from the RHB, about 28 to 30%, including the acquisitions for group, 5% roughly for retail, and 17% overall, group plus retail. How has that number changed? Say 5 years back, what was your market share? Or 3 years back, what was the market share?
So I think we've been adding about between 50 and 100 basis points of market share every year. That's been mostly organic from FY18 to FY23. With the acquisitions of Medvantage and Raksha, I think we've added about another 350, 400 basis points of market share, overall. So if you look at the overall group and retail health insurance premiums, we would be almost 20% across all of us.
Including all the acquisitions?
Including all the acquisitions. If you look at India's health insurance market premiums, we'd account for about 20%, whereas if you looked at just the portions that are managed by TPAs, we would be almost 40+%.
Okay. Very quickly, you derive almost 80% of your revenues from 5 clients. Is that a risk?
I think that's how the market has evolved, especially on the group side. See, we work with 27 insurance companies today, actively. As Dr. Vikram said, as the market resets itself, and we still have a 94% retention rates, which means there are groups that are moving across insurers multiple years, and we continue to remain the administrator.
You're looking to bring this number down? Is it uncomfortable for you?
I don't believe so. I think it is
fair. So you would be happy if it stays the way?
And it has already changed significantly over the last 2 years. And I think September, it would be closer to a 70-30% number. And that's how the market is evolving. And we will track to the market.
So the numbers I have is FY21, 78.23, 22, 78.95, and FY23, 77.97. So it's not really changed in the last year.
In September, it is 71%.
But will you bring it down further?
No, I think it just depends on how the group market evolves, and then we continue to track. And especially on retail, for example, in our retail business, nearly 50% comes from the private insurers, and 50% comes from the public sector insurers. So as we improve our retail penetration, as the group market dynamics change, I think the numbers will automatically change on their own.
Okay. Thank you, gentlemen. So just as I quickly wrap this up for our viewers, this is a company which has grown at 25% over the last few years with very stable margins. It's fought competition. There hasn't been any decline in the fees or the yields that you charge. And this should sustain going ahead, right?
That's a fair summary of where we are as a company. Thank you.
And you will continue to make acquisitions. That's something.
There, I would like to say our core main sale is the organic growth template that we have, and we're very comfortable with that.
On that margin, do you think you can increase it, or should we assume stable?
At this point in time, I really don't want to look into the future. I think we've continued, at least historically, to deliver a stable margin profile.
I just want to end with one risk that the street is talking about. You've already said pricing is not too much of a threat. But what if the insurance companies from which you get 100% of your revenues decide to do away with the services of TPA and do this in-house? Is that a risk? Because there are insurance companies who don't use TPA, like Star Health, for instance. What if this becomes a trend?
Very fair question. First of all, I'd answer that by saying globally, the trend is that TPAs are integral to the ecosystem of health insurance in most, if not all, geographies. In India, that's a trend that's evolving, and TPAs are increasingly increasing their share of participation in that ecosystem. I think the best way to look at this problem statement is the fact that the growing complexity of the way products are built and sold and administered in India will continue to only need specialized players like Medi Assist as we think about the world of tomorrow.
Gentlemen, thank you very much for joining in and wish you all the very best.
Thank you so much.
Thank you very much.
Much
Thank you,
appreciated.
Rima. Thanks for
Thank
having
you.
us here.